Welcome to Let's Talk About CRPS, a podcast brought to you by MTI directly from Italy. We will talk about the latest news and treatments, patients' experiences, and exclusive interviews of CRPS experts. Don't forget to subscribe to our YouTube channel and visit our website crps-treatment.com. Let's take off! Hi guys, welcome to this new episode of Let's Talk About CRPS. Today with us we have my super colleague Sandra.
Hi.
We want to talk about something more internal to our company this time, something that's very important, the two roles that are the patient managers and the patient care coordinators.
Exactly.
So we have two different roles, two very equally important roles, and we kind of wanted to
dive into that a little.
Exactly. Just bring you at work with us.
Exactly.
So, yeah, like
just
we
to
said,
shed some light on what we do here, because sometimes
Exactly.
people, get a bit confused, I guess.
Exactly.
With who's gonna follow me when I'm here, who's going, to be the person with me in the clinic. So I wanted to explain a bit how it works. Well, Emily and I, as you might know, we're patient care coordinators. So, that's our role in this case.
That's the first one.
Yes.
So these two roles, basically, what's the main difference between these two roles is that one of them is present before the arrival of the patient, and the other one is present during the treatment week for the patient. Both of these roles have to have the same kind of values, I think, as for the person who's doing them.
Yeah.
Empathy, 100%. We have to have people who know how to listen, who know how to give advices when they're requested. And then individually, each roles have to have really specific key points, let's say. I would say let's dive in directly on the patient care coordinator. I'd say let's start with, because that's the first.
Yeah, that's the first contact that you usually have with the company.
Exactly. So the patient care coordinator, which is what we do on a regular, basically we're the first point of contact, like you said, to the patient. So whenever we receive an email, whenever we receive a request for a video call, that's the first person you talk to. That's us.
Exactly.
So the role is really, first of all, understanding, because we do work with different conditions, of course, as MTI as a company. Specifically, we do work with the CRPS division, but of course the first call is trying to understand the condition that we're dealing with, the level of the condition, the advancement of the condition, and then kind of get a good idea of the case. Every single case is different. We want to have some key information, for CRPS specifically, how long you've had it for, how it started, you know,
for sure,
where it's located, has it spread, just a bunch of information that are important to us, but also mainly to the doctor that we work with and who's going to go through with the evaluation of the case. So the first call is really the first moment when we meet. So it's important for us to also share who we are, what we do, how we can help you for the whole treatment. So I would say, first call is one of the most important,
Yeah, I mean, also people who contact us, of course, usually have a lot of questions, aside from the CRPS itself. It's a lot about explaining what we do, how the treatment works, all the planning that goes behind this. So, it's also to explain how everything works on the inside.
It's from both sides, really, because we have a lot of questions for your case, but you have 1,000 questions, of course. And
I would say,
the
call is like divided in these two.
In these two sets, Questions for me, questions for you.
Questions for you,
And it's just easier to go through with this kind of conversations on a call instead of doing it via email. I think that creates a bond.
It does. It's different when you see someone face to face. You actually put a face to the person you're talking to via email. So I think it's a bit more subjective and personal.
No, it's definitely more human to start with a call. I think that's the first moment when I get attached to the patients I'm going to follow.
Yeah, because you also put a face to them, so it's different. You're not a name anymore. Or,
Yeah. So I think it's just, that's the first moment when you really get attached to the people. So that's one of the first
Yes.
roles that we do as a patient care coordinator. Then of course, whenever we're going to have all this information that we're going to gather on the call, and then with the medical records that we will require, the second step that we take care of is helping with the evaluation of the patient's case.
Yes.
So of course we work with doctors. They're going to be the one doing the evaluation of the case.
Yes.
We will
follow the process basically and guide them a bit.
Guide the patient in what you need to give me, when you need to give it to me.
Yes.
And
of
then,
course, how long it takes for a reply. Whenever we get a reply from the doctor, which is usually quite short time, a couple of days really, we're the one communicating it to the patients and
exactly.
telling them, in case there's anything they have to improve, like
like values.
Yeah, exactly. And values.
There's also work of translation in between, of course, because whatever information that will arrive from the patient, of course, will be mostly in English, so it would have to be translated in Italian.
We've had also cases of patients, from Spain,
France,
Latin America, for example, French, also Portuguese, actually quite a lot. So we also had to have, the translating part to then sending to the doctor, communicating all of that. So it's, it's not something that it's that simple. I would say it's not overnight. You actually have to work for that. Yes,
it is a process. And then whenever the evaluation of the case is done, and then if we have a confirmation for as far as the eligibility of the patient, then of course we start the biggest part, let's say, of our job, which is the organization of the whole treatment week. So of course, as you may or may not know, the only thing we do not take care of are the flights.
Yes.
Because a lot of you have miles, prefer the airport, etc., etc. So that's, we'll leave it in your hands. Everything else is in our hands. It's really from the moment you land at the airport to the moment we'll drive you back at the airport. Everything is literally just in our hands. So we'll be taking care of booking the hotels, but not only all the medical appointments, making sure we have the rooms for the infusions, for example, making sure all the specialists are connected during this treatment week, available at certain times, creating a timetable that would work for the patient too, so that we're not gonna exhaust the patient.
Yes, we don't want your days to be endless. So usually we try to just time everything perfectly. So you also have some time, for example, for other activities like resting at the hotel, using the site therapies, I would say, complementary therapies, also some sightseeing, I would say. Yeah,
of course. So that's definitely the whole organization of the treatment the treatment week. It has to be super detailed, super specific, and of course available for the patient and the patient manager. That's also one of the first moments when the patient care coordinator and the patient manager are going to start working together, because that's the moment in which, this is this patient, they are going to come at this date from this date, you're going to have to go and pick them up at this time, the hotel that we've selected for them is this hotel, you would have this appointment on that day, this appointment on that day. I would advise for you guys to go and do some tourism if you have some time.
We also give them some days, like for example, of course it all depends on the patient, but it's all quite coordinated, I would say.
For sure. That's when the patient manager is kind of
a continuation of but I would say that
you're like giving the flame to the patient manager. It's like and then of course if there is any additional items that would need to be brought for the patient, for example, we do provide wheelchairs or crutches if the patient would need help with movements. We have to coordinate with the airport if they have booked their own wheelchair with the airport, making sure we'll bring it when we do the pickup. If we bring a wheelchair, how many people are coming with the patient? Would be how many luggages would they have? Would we need this specific car or that specific car? If we have a wheelchair and we have 5 luggages, we have to do a bit of math in here and understanding what kind of company car.
We don't want to leave anyone at the airport, because we can't fit in a car.
Or luggages. So there's a huge organization behind, which we do our best to not show the patient really. So we want to have everything stress-free, everything ready, everything perfect. But there's a lot of organization behind it. Will the patient be using the biophysical therapy? Yes.
That's also more luggage in this case, because you have to bring them to the hotel, you have to get them set up, and
we have to bring the site therapy to the hotel. If they will be using the biophysical therapy, we would need to go ahead and change the mattress, because it is a specific mattress when you be using the biophysical therapy. So go ahead and coordinate with the hotel so that we make sure that they get. So there's a lot of work behind. So that's basically the patient care coordinator for you. And of course, I think one of the important part is also making sure that the patient manager, we will choose his personality or her personality will go ahead
with the patient.
Nicely with the patient. I think that's something that we kind of just do automatically. But
because we know them so well.
We know them very well, and then we get to know the patient very well. So I think that's just a plus that we can do for the patients, making sure that we pair them really well with the patient managers. So and then I'm going to use this to kind of just throw you the card here and let you tell us a bit more about
the patient managers. I would say it's like an extension of the patient care coordinator. It's like our right hand in this case. We know them so well, and that's because we try to mirror, into them what we want to see them do with the patients, and they have been doing an amazing job in this case. But while we are the first contact in this case with the patient, like video call, email, everything else, the patient manager is a person actually on the spot, like the first person they see when they land here, and they of course wait for you at the airport as well, so they are actually the first ever person you see when you arrive. And it has to be a good face, a smiley face, someone who's ready to help you,
that brings you confidence.
Yes, exactly. As I was saying, all the coordination going behind leads to this, which is the arrival of the patient. So we have them doing a lot of different things. I was just gonna, tell you a bit of a list of them, because I'm sure whichever patient comes here, they will actually get to see it in person. But it's good to know what expects you before arriving here. We have them picking you up at the airport, so that's the first important step, and everything is already well prepared for that, since they know when to come pick you up. They are in contact with you as well via message, just anything that can be direct. They are with you there, they have the wheelchair ready, they have the car ready, they know how many luggage you have, which is something that we push a lot to know. They are there with you as well for the checking at the hotel, for explaining these complementary therapies, the light therapy, the biophysical therapy. They're with you there because, it's hard to know how to use them at the beginning, so they try to explain it and everything else. Regarding the clinic, they're also the person there with you, so they pick you up in the morning, they go with you, they are there with you for lunch as well. You don't get to do it all on your own. They're also there for translating, which is very important. They have to know the language very well, and it's something that we pushed a lot when choosing the person for this kind of job, I would say, role. They have to know it quite well, because with a doctor, nurse, you have to know how to translate medical things, because it's very, very important and serious. It's your health at stake here, so it's good to have someone who's very well read.
We want the patient to never be in a situation where they don't know what people are saying around them.
Yes, exactly.
I think that's important.
You have people speaking English at the clinic, but it's not that well sometimes. So it's good to have someone who actually knows quite well. During the visits, for example, they are a big support, I think, in this. They are actually there all the time, and for anything you might need, they're there. Any emergencies, anything, even small stuff like I want to go, I don't know, get this at the store. Can you bring me? Can you, point me at the best one? And they are really there for anything, I think. And emergencies, really, you have people calling them in the middle of the night, for example, and they will answer and help you as best as possible. It's
just a nice presence to have at the hospital too, because I think try imagining doing it on your own. You're at the clinic on your own, maybe scary, the nurse don't speak the language, and you kind of just want to ask for something that sounds silly, like, is it normal that it's kind of itchy or something? That you would feel like, oh my gosh, she's not going to understand it. How do I transmit itchy to a nurse? And it may sound stupid, but I think it just relaxes you a lot, knowing that you have someone.
It's stress-free, I would say. That's what we try to do here. as I was saying also, aside from, of course, the treatment itself, we also have them coordinate with us for tourism, for example. We were mentioning it. We have quite a lot of beautiful places here, I would say.
Yes, we do.
We have different options, of course, based on what the patients like as well. Sometimes they can tell us, listen, I don't want to do this and that. So we try to accommodate them and bring them to other places. We have different kind of tourism. We have the full day, which usually can happen, you know, in bigger cities, like we're talking about Venice, for example. So we actually go there for the entire day, yes. We also brought someone to Bologna, I think, and other big places. So, you know, it's been kind of different cities around here, even which are far away. I think Bologna is like an hour and a half or almost 2 from here. So. Well, we have half days depending on how the patient is feeling, of course. We go to like Garda, we go to Verona with the center. So it's all quite beautiful. And of course, this is trying to make not everything about the treatment and actually giving you some time to relax and just
get to see around you.
And also kind of detach your mind a bit from everything that's going around here.
But once again, we know how to do it stress-free because we know, you know, if you have it on your leg and you've had it for 5 years, I know that you can't like use that leg specifically. So I'll bring a wheelchair in the trunk just in case, even if you don't know that. I'll have it ready.
We'll have it in the car, even though you
like
don't know.
what street to take you on so that you don't have the cobblestones on the floor. I know what restaurant to take you in so the wheelchair is going to fit it. There's just a lot of things, even just for an afternoon of tourism, that are really in the mind of a patient manager for sure. And just making sure that you never have a moment when you're like, oh, I would really like to see this church, but it's full of cobblestones and I don't know how ever I would arrive there. No, we have everything settled down.
Another thing that I want to mention is, for example, at the clinic, when we're seeing the doctor, sometimes he can prescribe some additional, you know, supplements, really, yes. In that case, of course, we have the patient manager handling that as well. As in, they will bring you to the pharmacy as soon as possible to get everything you might need. So this is, you know, little things that I think are very important and that patients, you know, can't really get anywhere else. I think someone just right away driving you and, you know, getting everything ready. And I also wanted to talk about a bit the coordination between us and them.
I mean, that's a massive point, really, because we have two figures that are equally very important for the preparation and for the going of the trip.
And one of them is out on the field, I would say, while the other one is at the office. So it's two different. But they're always connected. Yes, exactly. We also rely a lot on the patient managers to tell us about the day at the clinic, what the patient did like or didn't like, to know how to proceed for the other days. If we have to change something regarding the room, in case they need any kind of improvements from us, at the hotel, at the clinic, you know, any changes, we're there for that, you know. No issues at all.
And of course, it can't be just on the shoulder of the patient manager because they have to really take care of the patient they have in front of them. So that's why the coordination between our two roles are really important, because they will just drop me a message and say, oh, maybe they want to change the hotel room, maybe they want it to get like a bigger one, or they wanted to get a view on the garden instead of on the pool or whatever. They just drop a message, and then from my side, of course, at the office, I'll be like, okay, changing the room, contacting the hotel, etc., etc. We have a lot of other examples, you know, maybe the patient is here for the CRPS treatment, but maybe while they're here, they wanted to do a visit with the neurologist just to do some extra check, send me a message. Let me organize the whole thing for you. The patient really want to try this absolute typical Napolitan pizza, send me a message, I'm already booking the rest, you know. So there's a lot of, coordination between the two roles. And I think that's what makes the whole thing so smooth, so stress-free for the patient. And I think when we get to explain it like that to other people, then people get to understand, wow, it's actually really hard to do it on my own, you know, because it's not just... We've had sometimes people who say, oh, I want to try to get a hotel on my own and I want to see how that goes. And then again,
of course they can do it, yes.
Of course you can do it.
That's something that definitely
But then we've had situations in which maybe they have a problem with the hotel because it's not a hotel that we have, you know, selected, like the one that we collaborate with. And so it can happen that they have a problem with their own hotel, and then we don't really have everything in our hands in that situation.
Yeah, it's something that we can't really handle.
We can't really help a lot on that case.
We try to work it, around it.
Yeah.
We still can't get you, in the morning. We're there with you at the clinic, so it's something that we can definitely do. But it's easier when we're the ones handling everything and making it,
just because there's a lot of work in behind, the collaborations that we have both with the hotel. And
we can also make sure that the quality is actually the ones that we want it to be, and that the patient deserves to have. You know?
And we know it's a hotel that is quiet, so they're not going to be bothered by a lot of noise, and we know there's a lot of grain outside. They can get out for some fresh air. They have a terrace in which they can get some like real relaxing moments. So we have selected both hotels and cars. The cars that we have here are comfortable. They are big enough to
fit
have a wheelchair, but also have someone maybe who need to have their leg extended. And then we'll bring a cushion for the transport. So there's a lot of things that you don't think about when you go and
it's
travel.
the small things, but actually they're huge, because anything could actually turn into an issue while they're here. Even the smallest thing, like noises, can't sleep at night, that will still have a big influence on the day at the clinic, how the treatment goes, how they feel after. So we try to make everything really as stress-free as possible to make this week of treatment go smoothly. And I think that's important, because if you found yourself on your own trying to do it on your own, like you said, the whole stress of the travel already, like the fact that you actually have to fly here, the flight itself is already quite stressful, even more when you have pain, swelling in that area. So I think that having the person here already waiting for you is a huge relief. Because really, once you land, you don't have to care about anything else. Really.
Because like you said, everything can turn into an issue, and just knowing that you have a team of a lot of people, but mainly, you have these two specific people, the patient care coordinator and the patient manager, who are 100% dedicated to you. The patient manager will be always with you. The patient care coordinator will stop whatever they're doing
to help,
in that help with anything that will be, so that you have these two people behind you. So that's really reassuring.
Little guardian angels.
Yeah, exactly. We have been called guardian angels in the past. But yeah. Anyway, I think that's it for today. We just really wanted to share this with you, make you understand what we do.
Just a little bit of insight in our daily life, I would say.
On a daily basis, and make you understand, the importance of the roles, because they are really important.
They are. So, well, thank you so much, Emilie, for having me again.
Thank you for being here.
You definitely see me again.
Thank you, everyone, for listening to this episode. We'll see you next week for the next one of Let's Talk About CRPS.
Bye-bye.
Bye.